Hi, now I'd like to demonstrate for you high velocity, low amplitude thrust in a modified lumbar roll position for an anterior innominate. Okay, if we'd like to execute this manipulation, we'll have our patient supine. I'm going to ask you to turn on your side to face me. I'm going to straighten out the lower leg and pull it like that into flexion. I'm going to interlace the uppermost leg behind the popliteal surface of the knee, like that. I'll place the uppermost hand on her hip, like that. I'm going to palpate the PSIS at the SI joint. I'm going to roll through here, locking up the facet joints of all the lumbars all the way down, and I'm going to bring in a bit of extension as well. So rotation and extension to lock up all the facets of the lumbars all the way down to L5 and S1, so I'm isolating the manipulation to the sacroiliac joint. Then I'm going to ask you, it depends how flexible the patient is. Someone who's very tight might hold the wrist. Someone who's mobile, you might hold the person's hand over their own elbow. I'll interlace my hand here like that. I'm going to place it on the PSIS. You can drop your hand down like that and your elbow down on mine and relax. Now in this position we've got an anterior innominate, which means like a steering wheel, the innominate has rotated forward, and I want to posteriorize the innominate. So I'll place the dorsum of the soft part of the dorsum of my forearm along the meaty part of the gluteal muscle here like that, along the ilium like that. And in this case, I'm going to rotate down as I drop with the body. So I'm in the stance that I'm in, as you can see, is like a fighter stance. So my back is not flexed, my spine is in neutral. I compress the shoulder here and stabilize the shoulder. We'll take a nice deep breath in and posteriorize and adjust. Okay, and that, everybody, is an adjustment for an anterior innominate.